Hey everyone, and welcome back to your PTCB prep guide. Today, we're going to jump into two really big topics: hematology and cardiovascular drugs. We'll be going through some exam-style questions to really sharpen your skills and get you totally ready for the PTCB. You ready to test your knowledge? Let's get started.
So here's how this is going to work. I'll put a question up on the screen and read out the options for you. I want you to pause, really think about it, and lock in your answer. After that, we'll go over the correct answer together, and I'll explain why it's right. Sound good? Okay, let's dive in.
All right, let's kick things off with our first question. This one's about a pretty common side effect. Which anemia drug may cause dark stools and constipation? Your options are A. Cyanocobalamin, B. Folic acid, C. Ferrous sulfate, or D. Filgrastim. Go ahead and pause here, think it over, and pick your answer.
And the answer is C. Ferrous sulfate. Now, this is a super important one for patient counseling. You always want to let patients know that dark stools and constipation are really common, even expected with iron supplements. That way, they don't get worried when it happens. Okay, next question. A patient is on epoetin alpha, you might know it as Epogen. What condition do we need to keep a close eye on? Is it A, hypotension, B, hypertension, C, bradycardia, or D, hypoglycemia? What do you think? Pause here and make your choice.
If you picked B, hypertension, you got it. Epoetin alpha is what we call an erythropoiesis-stimulating agent, or an ESA. It's a mouthful, I know, but like the name says, it ramps up the production of red blood cells. All those extra cells can kind of thicken the blood, which, you guessed it, can lead to higher blood pressure.
All right, on to question 3. Your patient is taking warfarin, brand name Coumadin. Which lab test is absolutely essential for monitoring their therapy? Is it A, APTT, B, INR, C, platelet count, or D, hemoglobin? Go ahead and pause and lock in your answer.
You got it. The answer is B, INR. The International Normalized Ratio, or INR, is the gold standard for warfarin. It's all about finding that sweet spot, right? We use the INR to make sure the blood isn't too thin, which would risk bleeding, but also not too thick, which could cause a clot.
Okay, what about this one? If a patient has too much of an anticoagulant in their system and starts bleeding, which one of these drugs has vitamin K as its antidote? The options are A, heparin, B, warfarin, C, clopidogrel, or D, alteplase. Pause and think about it.
And the answer here is B, warfarin. This is a must-know for your exam, for sure. Warfarin works by getting in the way of vitamin K, which is needed to make clotting factors. So it makes perfect sense that if you give more vitamin K, you can reverse the drug's effect. Okay, here's question 5 for you. Macrocytic anemia. What's it most commonly linked to? Your choices are A, iron deficiency, B, vitamin B12 deficiency, C, chronic kidney disease, or D, lead poisoning. Go ahead and pause. What do you think?
The answer we're looking for is B, vitamin B12 deficiency. Let's just break down that word. Macro means large, and cytic refers to cells. So we're talking about large cells. When you don't have enough B12 or folic acid, the body can't make DNA properly for new red blood cells, so they end up getting too big and don't work right.
And just like that, we're halfway through. You're doing an awesome job. Hey, if you're finding this helpful so far, maybe hit that subscribe button so you don't miss out on any of our future prep quizzes. All right, let's keep this momentum going.
All right, back in the game with a drug interaction question. A patient is taking clopidogrel. From this list, what's something they should probably avoid? A, green leafy vegetables, B, grapefruit juice, C, dairy products, or D, bananas. Think about how these drugs are metabolized.
And the one to avoid is B, grapefruit juice. This is such a cool interaction. So clopidogrel is what's called a prodrug. It's basically inactive when you take it. Your body has to flip a switch to turn it on, using an enzyme called CYP2C19. Well, grapefruit juice blocks that enzyme, so the drug never really gets activated to do its job.
Time for a little terminology. What exactly does thrombocytopenia mean? Does it mean A, low red blood cells or RBCs? B, low white blood cells, WBCs? C, low platelets, or D, low hemoglobin? Go ahead, lock in your answer. The correct answer is C, low platelets. Let's just break that word down for a second. Thrombocyte is just the technical term for a platelet, and that suffix penia means a deficiency of something. So thrombocytopenia literally just means not enough platelets. It's a key term for understanding bleeding risks.
Okay, here's a scenario you'll definitely see. A patient is on lisinopril and they're complaining about a cough that just won't go away. What's the right thing to tell them? A, this is a common ACE inhibitor side effect. B, switch to a diuretic immediately. C, reduce salt intake only. Or D, continue without monitoring. What's the best advice here?
And the correct answer is A. Yep, that dry, hacking, annoying cough is a classic, almost famous side effect of ACE inhibitors like lisinopril. It's so important to tell patients about this when they start so they know it can happen and that they should let their doctor know. Next up, a critical safety question. Your patient is on a simvastatin and they call saying they have really bad muscle pain. What serious condition should immediately pop into your head? A, hyperkalemia. B, rhabdomyolysis. C, hypoglycemia. Or D, thrombocytopenia. Pause and make your choice.
The one we're really worried about here is B, rhabdomyolysis. This is a huge red flag for anyone taking a statin. Some minor aches can happen, but severe pain could be a sign of rhabdo, which is a dangerous breakdown of muscle tissue. That breakdown releases stuff into the blood that can seriously damage the kidneys.
Last question, let's make it a good one. A patient on digoxin tells you they feel nauseous, their vision is blurry, and they're seeing yellow halos around lights. What is the major concern here? A, digoxin toxicity. B, bradycardia only. C, hypokalemia. Or D, hyperglycemia. This is your final chance to pause and think.
And the answer, without a doubt, is A, digoxin toxicity. This is a textbook case, a classic presentation. That combination of nausea and especially those unique visual problems, like seeing yellow or green halos, are hallmark signs that the digoxin level in their blood is way too high and they need immediate medical help.
And just like that, you've finished the quiz. Seriously, fantastic job today. Remember, every single question you practice, like this, gets you one step closer to walking into that PTCB exam with confidence. You should be proud of the work you're putting in. Great job on the quiz. If this was helpful, you know what to do. Hit that like button, subscribe, and maybe share it with a friend who's also studying. We've got a lot more practice quizzes and simple explainers on our channel to help you get ready. Keep up the amazing work, and I'll catch you in the next one.